Doctors knew it was coming, and it is here. North Carolina recording its first measles case of the year. The infected child visited an airport, a museum, a grocery store, and more. WRAL's Eric Miller is tracking reaction on this for us tonight. Eric, what do people need to know here?
Alina, one key point that we heard this afternoon is that this is measles. This is not COVID-19. And that really matters when we're talking about this child visiting all these public places. With COVID, nobody really had herd immunity here. With measles, almost everybody is immune. It's just the people who haven't been vaccinated and the people who can't get vaccinated who really need to be concerned here.
UNC's Dr. David Wall says it's the day they've been training for.
We have meetings every week and we talk about, is it going to be this week?
North Carolina's first measles case of the year.
So this is a pretty serious disease, can be potentially a serious disease. And we want people to see it quickly, also because we don't want it to spread.
According to the North Carolina Department of Health and Human Services, that case was a child visiting Forsyth and Guilford counties from overseas. Between June 19th and the 21st, that child visited the Greensboro Airport, the Science Center, the McDonald's, and other places.
We're not asking everyone who was in these locations at these times to contact the health department. What we are asking is that they monitor for any symptoms.
Health officials are now urging people, if they haven't, to get a measles vaccine.
Vaccination is the most effective way to avoid contracting measles. So that's the takeaway here.
Measles cases have been rare in North Carolina the last few years. There was just one case in 2024, according to DHHS data. Before that, you had to go all the way back to 2018 to find any cases. But nationwide, they've been on the rise. And Dr. David Wall says that's a real concern, especially as vaccination rates drop.
We worry about the perfect storm of a whole bunch of people who are not immune getting exposed to this child and then passing it on to other people who are not immune.
Yeah, all right, so what should you be looking out for here? The symptoms of measles, those can occur anywhere from 7 to 21 days after exposure. Things like cough, runny nose, and a very high fever. Think up to 104 degrees are possible. There's also that full body rash, which typically emerges after a couple of days. We've got the full list of times and locations that folks may have been exposed. That's on our website, WRAL.com. In Raleigh, Eric Miller, WRAL News.